start from the top. So if you could briefly introduce yourself and what your profession is, and what do you do for that profession?
So my name is Genevieve, and I'm a master's student here in the School of Nursing at UT. And as a nursing student, basically a lot of what I do, I have a lot of clinicals, so I'll go into, we go into hospitals around the local Austin area, and we'll practice our clinical skills, we'll take care of patients, we coordinate patient care with the patient's primary nurse, as well as with pharmacists, with the doctors, with social work, with respiratory therapists, PT, OT, just a lot of interdisciplinary healthcare teamwork collaboration, utilizing a lot of our, not only utilizing our nursing knowledge, but also building on like our nursing judgment and stuff. So it's a lot of learning, learning a lot about the profession, learning about nursing. But yeah, that's kind of what I do as a student, just learning a lot and really getting to practice a lot of skills and learning how to work with patients. And yeah.
And how long have you been doing that?
So I started my program in June this past year, so we're finishing off our first year.
So how have you applied like basic biology concepts in your profession, if at all? It's okay if you haven't, but if you have, if you feel that it's applied, how has it applied to you?
It's actually really funny. I'll give a side tangent. Actually really funny because I also graduated from UT Austin with a degree in biochemistry. And so I recently got this survey from the biochem department. And they were like, here are some concepts you should have learned in biochem. Do you feel like you apply these in your current, whatever current profession or role you play in? And so I definitely think I do. I'm trying to think of what kind of foundational bio stuff there is. I guess I would say like, since I have a biochemistry background, it's more so like macromolecular stuff, basic things like, for example, when we give a drug, for example, do I know how that drug works on your body? If it's like a beta blocker, it's going to constrict your blood vessels and all that kind of stuff. And so it's, I don't know, it's just a lot of, I do see a lot of that bio, especially when it comes to body systems. Do you have to know like cranial nerves? You have to know, I have to know like the heart, the structure of the heart, anatomy, a lot of that kind of stuff. Even though it's not something that I would directly express to my patients, but especially in nursing, a lot of what you do is patient education. And so you have to know, how can I take these complex stuff, especially when it comes to the human body, and then how can I put that into terms that people will understand. So yeah, we definitely do use a lot of bio.
Thank you. So following that, do you think it's important for people of all majors to learn about biology then, like the basics of it?
Yes. You will not believe how many people, I'm in my public health rotation right now, and so a lot of what we talk about is health literacy. So do people actually know, for example, what their meds are actually doing to their body? Can they actually explain to me what is what is asthma and what happens when you have an asthma attack, and like it's crazy to me that sometimes somebody will have a health condition and not know how to explain it or not know what's actually going on in your body when it's your body, And so I definitely think that like bio is really important. I think whether it's in the high school level or in a college level setting, I think it's really important for people to know, because you can have, like a bachelor's degree and you can be like college educated, but then are you actually health literate? Are you actually able to know the basic components of like what's going on in my body and how do I take care of it? I think it's really important. And I think just intro bio stuff lays a good foundation for knowing that. So I definitely think it's important.
So what interests you about bio? Because you obviously pursue a bio-related profession. So what is it about biology that interests you?
I think for me, I would have to say it's crazy to me and I think bio covers a lot of stuff, but I think for me, even in healthcare, I'm focused on the human body. So I think what interests me a lot in biochemistry specifically was how there's so many of these small, tiny little molecules that just run around your body, and that's just how we breathe, that's how you think, that's how you have a heartbeat. It's electrical impulses in your brain, in your heart. And it's just crazy to me that all that kind of stuff is the reason why we're walking and talking and have feelings and are human beings, So I think that specific aspect of bio and how you see all the different body systems, like you realize that, like for example, if you think about cancer, and I think or something maybe like a genetic defect, like mutations, I think those things could happen so easily, I guess. But then at the same time, like you realize, man, it's a wonder that so many of us are healthy or are blessed to be healthy. And I think it's crazy how the human body is able to self-regulate, is able to keep itself in check. Even all the defense mechanisms that are in place for us to even be alive, I think it really intrigues and interests me. So I think that's really what I like about bio.
So then what was your favorite bio-related class, or did you kind of dread them all?
I think my favorite would have to be, there's an upper division bio class that a lot of healthcare professionals take called physiology. And I took it like my junior year of undergrad, and I didn't do so well in it. But I think back on it, and I'm like, for me, I'm the kind of person that has to know like why. So like, why does this happen? And I think physiology answers a lot of those questions. It tells you a lot about the mechanisms, what goes on in your body. So I really enjoyed that class.
Okay, and the next question is, did you do anything outside of your classes during undergrad to prepare you for your profession?
That's a good question. Yeah, I think I definitely did. I have a really big interest in pediatrics, so as a nurse, I would love to work in the NICU, work with premature infants and stuff like that. So I've always loved working with children. And all throughout undergrad, I volunteered at Dell Children's Hospital, and I worked with their child life specialists there to play toys with the kids or help them feel more comfortable in the hospital environment. So I think just even being in that hospital setting definitely prepared me a little bit for just being a nursing student now and working in that clinical area. I feel like that was the main thing I think I did that prepared me.
And the last question, kind of curveball. Tell us about the process of photosynthesis.
Dang it. This is plants, man. I don't work with plants, I work with humans. Well, photosynthesis, something about light. Light comes in, it hits one of, oh my goodness, it hits either photosynthesis 2 or what? Or I know it's backwards or something like that, and then it triggers ATP synthesis, and it's just like a cascade. I know it's like a cascade, right?
Nice,
and then at the end of the day, the plant is able to release. I don't know how many, but I'm sure it releases oxygen somewhere in there.
Nice.
Something like that.
Yeah, perfect. Nailed it.
Hello, my name is Cedric Bernier, and I'm a second-year mechanical engineering student here at UT. I'm currently in Professor Sata's 2 to 3 p.m. Biology 311C class. As a mechanical engineering major, biology and health classes are not part of my curriculum. There's one natural science class that we have to fill, but oftentimes most students will choose to take a less work-intensive course rather than taking biology. And as a result, they'll never take a biology class throughout their college experience. When we were assigned the group project to talk to someone, a professional in the healthcare or biology related field, I wasn't sure how useful it was going to be to me as an engineer outside of the biology field. But after talking with Genevieve, she emphasized the importance of learning the basics so that we can become health literate, which made me, I think, more willing to take more biology-related classes in the future. When she talked about how most patients will not really understand how the drugs will affect and improve their health conditions, that was something that I could relate to because I myself have asthma. I have since I was a kid, and even though I've had it since I was a kid, I don't really understand the condition beyond after I'm working out or running too hard, my chest starts to get tight. So I think after talking with Genevieve, I feel more likely to promote my peers to take biology-focused classes and to become more health literate as a whole.
I did this biology project. I assumed that biology had little bearing on my day-to-day life, beyond the fact that it works in my body to keep me alive. However, after hearing Genevieve Chin's account as to why biology is so important to have at least some general understanding of. I've grown my appreciation for the application of biology in my day-to-day life. When Genevieve talked about having health literacy, it really made me think twice about all the drugs I put into my body that I don't give a second thought to. How do antihistamines really work? If I know how they work, can I use that knowledge to make decisions when there isn't a readily available remedy for my current health crisis? This makes me think about how we learn about enzymes and all the different molecules that will decrease enzyme activity, and seeing how drugs could be those molecules and how important that is for our daily health. I also realize for most professions, it isn't necessarily important to memorize fine details, such as what photosynthesis processes is, but instead to understand big ideas.
Hello, my name is Zhang Hongxiang and I'm a junior student in chemical engineering. In this project, although I didn't go with my team members for the interview, I learned afterwards by watching the video clip the importance of biology in our daily life. Actually, before Genevieve gives her aspect as a nurse at residency, I didn't realize learning biology can benefit us in terms of being health literate. Before, I just viewed biology as a class that I need to take in my degree plan. Now I feel like biology is more than just being a subject, but also a good opportunity for us to better know about ourselves and how our body work. Besides these, in this project, I also learned about team collaboration, like how we should divide the work and who should be responsible for what. I wasn't able to go shoot the interview, so I took responsibilities in editing the video. From editing the video, I learned how to use iMovie, which I did not really use at all before. To be honest, I acquired quite a lot video editing skills from this project. On top of these, I also learned how to do time management on this project by negotiating deadlines with my team members. So overall, I learned a lot from doing this project.